First of all, how do we help our nonverbal child communicate? This is the question. So I want you to understand that speech and communication happens when we are interacting socially. There is no need to speak if there is no one to listen to. So the more you want your child to speak, the more you would have to help them understand that it's fun to play with you and that approaching you socially is desirable. So how do you do that? You imitate them. If they make a sound, you do that back to them. And whatever they are doing, be engaged, be involved. And because we live predominantly in a speech environment and we rely mostly on verbal communication, we tend to miss non-verbal cues. It's important for us to get to the level of the person that we are trying to communicate. Why not just look at body language? Be an expert on facial expression. Many parents and caregivers by now may have an intuitive kind of understanding of what the child wants. So I would like to encourage everybody to back up and instead look at how the child is feeling, how the child is responding to the environment. And it's normal. I've done that as well, to give them what they want because you don't want them to be distressed. Quite often, communication is not about getting what you want. It's about fostering a relationship. And also, don't be too quick to talk. If you look at your own speed of speech, it is far too fast for your child. Leave some empty spaces and give your child the opportunity to talk. And also, avoid fillers, avoid wordiness. The simpler and the clearer your language is, the easier it is for your child to understand what you are saying. Reduce verbiage. Be direct. Do this. Come here. And things like that. And also, why do we communicate again? We communicate to share. We communicate to tell others, hey, this is fun. This is my interest. And follow your child's interests. And I have had stories of parents who, through the agency of, let's say, a Disney character, is able to find a path to communication. Whatever your child's interest is, get involved with this. And you may have to communicate via playing a video game. So be it. And lastly, consider assistive devices, which we will discuss, and visual support. So these are 7 strategies for you to consider before you start to get your child to repeat a word. This is our tendency. Say this and keep getting them to repeat a word. You need to know that the word you want them to repeat has a context, is going to be fun, and that you are engaging with them. This is my take-home message. And after familiarizing with the top 7 strategies, next, I would like to talk about assistive device. And many parents and caregivers may be very familiar with these pictures. These are called picture exchange communication system. What you do is, for every action, item, activities, you have a picture. So the child will pick a picture among the selection and hand it to the speaker. So let's say you want, the child is stuck, and instead of crying, you can teach the child to ask for help. So the sign for help, and there is a picture here for help. Please be quiet. This is a picture for being quiet. And the child can hand you the picture if things are too loud. So there are many things that we can use pictures for. And these are some examples of the system. And for those of you who would like to learn more about using the picture communication system, this is a reference that you can get from Amazon. Okay. Next, I would like to talk about what you can do further. You have prepared your child, you have made communication attractive, you have bonded with them, you have a routine to play with them, and you got into their interests, and they really see you as somebody that they want to go to and connect with. All right. It is always very helpful to enlist a professional. So especially if your child is nonverbal with autism, professional help does boost language development and language performance. And there are peer-reviewed research on this topic. Next, I would like you to consider these other things that you can do at home with them to further promote speech and language. I want parents and caregivers to know that being nonverbal is anxiety provoking. And nonverbal individuals tend to be more anxious and more ready to, more teary and more susceptible to emotional outbursts and things like that. So we can help them feel better, and it's important for them to be able to tell us that they are scared, that they don't feel good, and more than just helping them calm down, we also need to teach them that things that they are scared of may not be that bad. So through pretend play, we can help them desensitize to things that is anxiety provoking. So we find that it's important for the child to participate and act out in the scary situation and find ways to cope. So be next to them. Help them see that you are there for them and that life does not have to be so scary. That would help greatly, because it's hard for an anxious person to be able to learn. Learning can only happen in a calm and reassuring environment. All right, next thing that is equally important is to help them recognize their own emotions. So maybe if your child is a toddler, you can use Elmo, and you can use a scared face in Elmo. And let's say Elmo sees a bird and feels scared. You can also teach that, hey, since Elmo feels scared, I'm sure you also feel scared in certain situations. Recognizing emotion is one of the ways to help them regulate. The less upset they are, the better off they are in being able to learn. Calmness is key. So every time that a scary situation comes about, help your child calm down. You may want to develop a soothing phrase, what we call a mantra. Replay the mantra. This is all right. And make it fun, make it playful. And if your child has problem being exposed to certain environment, let's say the store, or let's say is afraid of flying, one of the mantra you can say is, airplanes are awesome. This is awesome. And exposure means to get them used to situations that bring about anxiety, and to reframe the exposure to see it as not so scary and even manageable. And like anything, a skill, especially the emotional state, cannot be trained immediately. It's a slow and steady, thing. So what I'm saying is anybody who is nonverbal or minimally verbal has a tendency to get upset. It's understandable. As they know more words, their emotional reaction will actually taper down. So it's all right. It's important to know that this is a phase and it takes time and it's gradual. Help your child step into the real world. The real world is noisy. The real world is full of speech. Get your child used to it. So, like anything, slow and steady wins the race. So expose your child gradually so that they are able to cope more and more and with more and more, of the world. If you're nonverbal, the world is a daunting place. So we want to help them familiarize with the world. It's important because the disorder of autism itself makes a person less likely to interact with the world because it's overwhelming and they don't know what to do. Our job as a caregiver is to be next to them and walk with them every step of the way as we go through the world. And it's important that they don't just stay in the room because it's too difficult. They can stay in the room to regroup. It is also necessary for them to be outside of the room, to go to a zoo, to go to a store, to be in the restaurant, no matter how hard it is, to get familiar with the environment of the world. Habituation. The goal of your child is to become habituated. It's a form of learning when someone stops reacting to a situation after repeated exposure. So in the case of anxiety-inducing situation, the fear is reduced considerably because you are there to support them. And we hope that this strategy will be helpful to the larger autism community and may contribute ultimately to lessening the anxiety problem for people across the autism spectrum. Remember, not being able to speak is equal to anxiety. How do you increase speech? Reduce anxiety.